The rectus femoris of the quadriceps femoris group attaches to the AIIS, which is inferior or distal to the ASIS. To locate it, we can locate the tensor fascia lati and then drop medially off of it, or we can locate the sartorius and then drop laterally off of it. Once we are on the rectus femoris, we need to ask the client to extend the leg at the knee joint to engage it, and so that it is the only muscle that contracts in this region. We can then strum perpendicularly across it. One advantage of this palpation position is that the client can flex the thigh at the hip joint without extending the leg, and the client can also extend the leg at the knee joint without flexing the thigh. The rectus femoris attaches distally into the patella, and then beyond that, via the infrapatellar ligament, into the tibial tuberosity. To palpate the proximal tendon of the rectus femoris all the way to the AIIS, we need to palpate the rectus femoris between the tensor fascia lati and the sartorius, and then passively slacken the rectus femoris by bringing the client's thigh into flexion. Then when the client extends the leg at the knee joint, as seen here, the rectus femoris will engage. We can then follow it in baby steps to the AIIS with the thigh passively held in flexion. It is important when we actually reach the AIIS that the rectus femoris is relaxed and soft so that we can feel the hard texture of the bony AIIS. The vastus medialis is superficial and easily palpable in the distal medial thigh, where its teardrop shape can usually be seen and palpated when the client extends the leg at the knee joint. We strum perpendicular to it and follow it to the patella. And as with all quadriceps femoris muscles, it then continues to the tibial tuberosity. The vastus lateralis runs down the lateral side of the thigh. It is a very broad muscle located anterior to the iliotibial band, deep to it, and posterior to the iliotibial band. In some clients, the iliotibial band can be located by pinching it between palpating fingers, as seen here. To engage the vastus lateralis, we ask the client to extend the leg at the knee joint, and then we strum across it perpendicularly. It is important to give the client a break each once in a while so they do not hold an isometric contraction for too long. As the client alternately contracts and relaxes the muscle, we can continue to strum perpendicularly across it, palpating as much as possible from attachment to attachment. As we continue palpating the vastus lateralis distally, we can follow it all the way to its attachment into the patella and then via the infrapatellar ligament into the tibial tuberosity.